making an end run around a roll call vote.
This is a procedure, by the way, that was used almost 100 times under Newt Gingrich and over 100 times by Speaker Hastert, which my friend Mr. Cantor supported most of the time, if not all the time. So this is not an unusual procedure. Unfortunately, the Republicans are a little bit like the boy who killed his two parents and then wants sympathy because they're an orphan.
Joining me now, Louisiana Republican Congressman Charles Boustany, a heart surgeon and a member of the Ways and Means Committee. Thank you so much, Congressman. Thanks for joining us. What's your response to Steny Hoyer?
Well, I think the American people have really rejected this approach, and they've rejected the bill. It's been shown in poll after poll, and that's why we need to scrap the bill, and let's get back to the table and put together a good step-by-step approach that the American people approve. You know, this is very, very complicated, and as a physician, I can tell you there are many, many problems with the bill.
But, of course, in our own new NBC News Wall Street Journal poll, the American people are evenly divided, 45, 46, wanting it passed, not wanting it passed. So it's not a total rejection. It's that people really are split down the middle.
Well, that's one poll, and there are a number of other polls that show a significant split. Keep in mind there are margins of error in these polls, but you know, really, if you really get out there and speak to people across this country, and certainly back in my home state, they're overwhelmingly rejecting the approach taken by Speaker Pelosi and the bill itself, and that's why we need to get back to a bill that will really bring down premium costs rather than increasing premium costs, is what we're going to see in this bill.
Of course, the argument from the Democrats and supporters of the bill is that this will eventually bring down premium costs and it actually will be budget saving.
Well, I think that's disputable, and we know in the short term premiums are going to rise over and above the current rate of rise that we're seeing. And this is going to hurt American families. And that's why I think there's a better way to do this. As a doctor who's worked with insurance companies and had to deal with them on a day-by-day basis, work with patients, and as someone who has an understanding of the healthcare system, if we're really going to get the cost down for American families and business owners, you got to go after the direct cost in this, and that's not in the bill.
Now, let me share with you some analysis from Peter Hart and Bill McIntyre, our two pollsters. Peter, of course, the Democrat, Bill is the Republican, and their interpretation of these data from the poll, and they've been doing these polls for years. It's considered the gold standard of polling. They said the public is disgusted and unhappy. The memo is pretty simple, said Hart. Americans to Congress, you stink. And that covers Republicans as well as Democrats. Is that message something that you guys need to internalize, that both Republicans and Democrats, if you're an incumbent, you're on the line right now?
Well, I think Congress is polling very lowly right now, and here's the reason. It's because the Speaker is taking a very partisan approach to this, and what the American people want to see is a new tone in Washington. They want to see us work to solve problems that American families are facing every day, such as health care costs. And when the leadership chooses deliberately to take a very partisan approach, that poisons the well. There are a number of us on both sides of the aisle that would like to get back to the table and do this in a reasonable way, step by step, that really addresses the core problem here, and that is getting the cost down so that we can hopefully over time improve coverage. That's the real goal.
Okay. Charles Boustany, Dr. Charles Boustany, thank you very much for joining us.
Thank you, Andrea.
And topping the headlines right now, thousands and thousands of volunteers and